Yesterday, we told you about a pharmaceutical company called Insys Therapeutics that is under investigation in several states. Now, some doctors associated with the company are finding themselves in hot water as well. Here's a look into some of the allegations and how you may be able to protect yourself if you have concerns about your own physician in part 2 of our series, Pushing Pain, Profits Before Patients.
Pharmaceutical company Insys Therapeutics is accused of deliberately targeting doctors who would write more prescriptions for its main drug, a highly addictive opiate called Subsys fentanyl, in exchange for payments masked as speaker fees. Connecticut nurse practitioner Heather Alfonso pleaded guilty to accepting about $83,000 from Insys in exchange for writing Subsys prescriptions for her pain patients. The money was allegedly paid to Alfonso as part of Insys Therapeutics' speaker program, which, according to her plea, was basically dinner at a nice restaurant.
Once somebody was a speaker for the company, they were expected to generate a certain number of prescriptions, and if they didn't, then they would be taken off the speaker list.
According to FDA guidelines, Subsys is only meant to be used for persistent cancer pain. But former Insys sales rep Shannon Walsh, based in Oregon, told CNBC that most of the doctors management told her to target had nothing to do with oncology or pain management.
Mostly they were general practice, internal medicine, family physicians. They just thought it was ridiculous that we were going in there calling on them.
The top prescriber nationally, according to a Health and Human Services Office of Inspector General complaint, was Michigan-based neurologist Dr. Gavin Auerbach. The criminal complaint accuses Dr. Auerbach of engaging in healthcare fraud and distribution of controlled substances. Among other things, the complaint said he was prescribing Subsys for patients who did not have cancer, and some did not even report severe pain. He billed Medicare almost $7 million for Subsys, mostly in 2013. In that same year, Auerbach received over $54,000 from the company for things like speaker fees, travel, and meals. Many people might not know this, but you can actually very easily check how much money your doctor is getting from pharmaceutical companies. This database is how we found that 2 physicians in Mobile, Alabama, Dr. Shulu Ron and Dr. John Couch, partners at a practice, received over $210,000 from Insys in 2013 and 2014. In May, they were arrested on drug and fraud charges. Both pleaded not guilty.
There was a level of coordination between the doctor and the sales rep and the company and the insurance company that was unusual in my experience.
That coordination is something investigators are looking into as well. For its part, Insys declined our numerous requests for comment. For Nightly Business Report, I'm Dina Gosofsky.
And we do need to point out that less than a week ago, the FDA granted Insys Fast Track designation, which expedites drug development, to review and potentially approve an oral spray to treat opioid overdose. We also reached out to Drs. Auerbach, Ron, and Couch, who are still working in their respective clinics. Only Dr. Ron's lawyer returned our calls, and in response to our queries about payments from Insys, Dr. Ron's lawyer told CNBC his speaking engagements are sought out, and this money is not out of line in any way. We make no apology whatsoever.